So, one of the things that I practice a lot and what I teach is staying away from feeding the doctors. Staying away from feeding the doctors is very important to teach. The reason why I do that is because there are physician companies out there that will openly admit that every day there is someone that is actually feeding them. And they actually line up people to literally make sure that every day that they're open, somebody is bringing them lunch. And what is fun is also if you actually look at some job postings by some physician companies, they will literally say lunch is included daily for all employees. And the reason for that is there's these marketers that are willing to bring in and spend so much money feeding them. So I want you to be able to understand, just because they ask for you to bring lunch, and that is the reason why they're willing to meet with you, that does not mean that they're going to start referring to you. Now, let's ask this. Does bringing lunches work? You know what? It can. But in all honesty, you want to keep it to a minimum. I would rather bring them dessert because that's cheaper. Now, let's say, for example, you actually already have that relationship. You already have that potential physician that you've been working with, and they're continuously referring patients to you, or they've been referring 2-3 patients to you already. Then I can say, go ahead over there and give them some lunch. But you also want to keep it to a minimum. You don't want to do what these other agencies are doing where they're lavishly spending so much money, feeding the doctors, the staff, whatever they want or whatever they really desire. I've even seen or known other marketers who will tell the physician, order whatever you want and I'll go pick it up for you. Just tell me where you ordered it. And you don't want to be this person. If somebody says, bring me lunch, what I will tell them is, you know what, doctor? I definitely want to be able to bring you lunch next time, although I will bring you dessert, and the reason for that is this. It's because I already have my lunchtime scheduled already, and I want to be able to meet with you, but honestly, you will enjoy the dessert I'm going to bring you. And I would go to Panera's, and they have this round Danish box thing that you can purchase for under $9. Very cheap to have, very cheap to purchase, and also you're not going over your budget for this. Because imagine if you're visiting 20 people a day sometimes, 30 people a day, or you're visiting maybe 50, 60 people a week. How much is that going to cost you if you keep on spending money? So ultimately, you do not want to be spending a lot of money for lunches and learns. Now, when we talk about lunch and learns, I'm talking about lunch and learns with just in the physician's office. Okay, that's where you don't feed them. Now, there are going to be times where you're going to be asked to come in to do a presentation, a lunch and learn presentation, where you're literally talking to about 30 or 40 people. Then we can talk about and see and look at that as a different thing. But if you're just going to a physician's office and talking to the physician, the nurse, the medical assistant, and maybe 3-4 people, then I would say no. Keep it minimum and don't break your bank, okay? But they do work, but you have to do it smartly. And when you're doing presentations, you want to make it lunch and learn presentations where you're sharing with them some information on why it is valuable to use your product in your company. But one thing I do teach is try to avoid from doing any marketing between the hours of 11:30 to about 1 o'clock. And the reason for that is if a physician's office is asking you to come in around that time, more likely they're expecting you to bring lunch. So you want to kind of schedule your visits somewhere around in the morning or in the afternoon.